Hello, I'm Dr. Brian McLaughlin. I'm coming to you with our discussion that we are talking about with the informed consent. This particular informed consent I pulled off of TennesseeLegal.com. It was a LPC MHSP counselor whose name has also been blacked out on there. Some of the things that I found when I was reading through it was talking about uh, kind of an introduction saying that they're glad to have this particular person um, as a potential client, talking about the counseling process, talking about any kind of risk that are associated with it as far as any kind of sadness, anxiety, anger, excuse me, frustration, things that they listed on there. People who can have unpleasant experiences. They talk about their background, where they graduated from, what degrees they held, where they um, were before they became a counselor, um, and things of that nature, as well as what the expectation is for both the client as well as the counselor, if they would to have that kind of relationship for the informed consent. Also, providing phone number for contact, and then also any kind of emergent situations as far as if they need to get a hold of their spouse or significant loved one, or um, the fees that are associated with it, um, any kind of medical records, stuff like that. Um, this is very detailed, 7-page informed consent that I found, uh, and how it lines up with the ACA. When I was looking at the ACA informed consent, the ACA A2 8.2.A informed consent talks about that clients do have the freedom to choose whether to enter or remain in a counseling relationship, and need adequate information about the counseling process and the counselor. And that is something that was actually discussed in the informed consent when they were putting all of that together for the client, as far as going on through all the different types of ACA, as far as A.2.B, um, types of information needed as far as what they qualify for, services and stuff like that. Again, that was also something that was discussed in the informed consent, as well as the cultural sensitivity as far as whether the um, need an interpreter or anything like that in A.2.C. Now, that was not actually something I remember seeing in the informed consent. I'll have to go back and look, but there, the cultural sensitivity thing that I think is a really important aspect, because it helps to see if we're able to help somebody who may have a language barrier or not. Um, an ability to give consent is the next one, A.2.D on there. Counselors recognize the needs of balance of ethical rights of clients to make choices. Um, that is something also that was discussed in the informed consent, as well as the mandated client, as far as um, you know, if there were any type of limitations to the confidentiality, which was discussed with, like, if you had a spouse or somebody who wasn't supposed to be involved, it was shown in the informed consent. And the Tennessee rules and regulations talks about being actively engaged, talks about advertising. This was found right off of the Tennessee.gov website, talking about having an approved supervisor. That's something that Tennessee is huge on, making sure that you have somebody that's working with you for at least 5 years, licensed for at least 5 years, and takes the time to help in that regard. So all in all, the whole package, the way that the informed consent was for Tennessee and the ACA, and in the state of Tennessee, guidelines, the rules and regulations, they all married well together.